Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today I'm at the University of Oklahoma Physicians, OU Physicians in Tulsa, we call it. And joining me to talk about kidney disease is Dr. Charles Foulks. You are the chairman of internal medicine.
Yes, that's correct.
Okay, welcome to the program. This is the first time I've had you on the program, so I'm excited.
Okay, well, Pam, it's a pleasure to be here today.
Yeah, there are not many of you in terms of specialty in our state.
No, they're not. We're one of the smaller subspecialties of internal medicine. We take care of what really amounts to be a small number of patients, but a number of patients that we have been able to provide dialysis services for so that people can live instead of die, so that they can be grandparents instead of dead, so that they continue to work at their jobs as teachers or engineers or policemen, or, you know, jobs I think that are really good jobs are being grandfather and grandmother and mom and dad.
That's the fun.
That's the fun, and we're able to provide that to people with kidney failure.
Okay, now we're going to start off talking about the specialty of nephrology. Tell us exactly, what is a nephrologist?
Okay, a nephrologist is a person who takes care of patients who have kidney disease of some sort. The kidneys function really to clear your body of toxic waste from the food that you eat, primarily from the protein that you eat. It also regulates your red blood cell count because the hormone that makes your bone marrow make red blood cells comes from the kidneys. And it also regulates your bones because of the calcium and phosphorus metabolism, and the vitamin D metabolism are regulated by the kidneys as well. So that as you develop kidney failure, you develop the ability to maintain your red blood cell count up, or your hematocrit. You lose your ability to manage your bones and your serum calcium properly, so you get a secondary hyperparathyroidism or an overactivity of the parathyroid glands, the little glands that sit on the thyroid that regulate your calcium level and your bone content. And then you also have the buildup of the waste products from your protein intake, and those cause a variety of problems, not just with the kidneys themselves, but the intestinal tract, heart, lungs, brain, you name it. As the kidney fails, the rest of your body does not do well at all.
Okay, a very vital organ in our body.
Absolutely.
Now let me ask this question, because we will get into some specifics of diseases that affect the kidney and even chronic kidney disease, but let me ask you in terms of the normal functioning kidney. Are there things, because sometimes we don't know, doctor, that we should do or could do to keep our kidneys healthy? For instance, we always hear about drinking water. You know, drinking at least 8 glasses of water a day. I mean, is that something good that directly benefits the kidney? Vitamins, we're a vitamin conscious society, so
right.
I mean, are these vitamins helping, and are there certain vitamins that would help more than others? Kind of give us an overview of the healthy functioning kidney, how to keep it.
Certainly. Well, one of the ways to think about the kidneys is to remember that, or to know that when you have normal kidney function, your kidneys are able to take care of a huge input of things or being totally deprived of things. In other words, if I were deprived of water now, I could live for probably close to a week without having water. My kidneys would conserve water. I would not excrete it. I can tolerate that. By the same token, I could, and I'm sure no one in the audience has ever done this, but you could go out to the football game, you could tailgate before, you could have a few beers, you're able to tolerate that volume of fluid and get rid of it. It's not a problem.
Okay.
So you're able to tolerate large ranges when you have normal kidney function. As the kidney function begins to worsen, those ranges of what you tolerate narrow to the point that as you get to very advanced kidney disease, you can't tolerate very much change in your diet or in things that happen to you.
So drinking all this water that they tell us really is not maintaining the health of the kidney.
It doesn't do anything except...
It does other things, but not for that kidney.
But not for that kidney. That's absolutely correct.
Okay.
And in fact, if you have very advanced kidney disease, that's actually very bad advice.
Okay.
So I'd stay away from that. In terms of vitamins helping the kidney, as of right now, we're not aware of any vitamins that have any effect upon kidney function. Although when you look at what happens as the kidney function decreases, your ability to maintain active vitamin D levels is impaired. And so one of the things that we do recommend is that people do be on a vitamin D supplement of some sort. And in fact, there's new data now showing that even people with normal kidney function have about a 60% chance of having low vitamin D levels. We used to think that all the vitamin D fortification of foods would protect all of us. That is not the case. When you're older or you're sick, you don't go out in the sun. We've learned to use sunscreens and hats and long sleeve shirts.
Right.
And so it's very common for even normal people to have a low vitamin D level. So we're now recommending that people, even normal people, have an increased intake of normal vitamin D in the somewhere of around 800 to 1,200 international units a day.
Okay, and we know that that vitamin D, as you sort of alluded to before, helps us to actually use the calcium that we're taking in, which helps maintain the integrity of our bones as well.
That's absolutely correct. That's absolutely correct. So that's the only thing I'd really say about vitamins. The most important things you can really do to protect your kidneys are the following. If you have high blood pressure, get it controlled and keep it controlled. If you have diabetes, get it controlled and keep it controlled. If you have a high cholesterol, get it down and keep it down. If you're overweight, get your weight down and keep it down.
Okay.
If you're looking at a dietary thing that you can do, is eat a normal or a recommended daily intake of protein per day. I've been up here for about a year and a half. I was in Texas at Texas A&M and Scott and White Clinic for many years. And I used to joke that I would have, you know, my typical Texas guy would come into clinic, and I'd nickname the prototypical Billy Ray Joe Bob. And Billy Ray Joe Bob would come into clinic, and you take a dietary history from him, and he would eat half a cow for lunch and the other half of the cow for dinner.
Okay.
I mean, you know, we're looking at a meat-eating society.
Okay,
where we
right.
eat way more meat than we need to do. The normal adult person in this country who's not pregnant or not breastfeeding needs 2 portions of meat per day. Each portion is about the size of a deck of playing cards.
Right, and we've even said, I've had a dietitian that talked about we could use our hand. The palm of our hand is about a serving size.
Yeah, a palm of your hand is a perfect serving size. That's absolutely correct. Now, that also is true for the thickness as well. You don't want to pretend that that palm is this thick. And get
Right,
that
and we
big
did
of
say
a-
didn't include the fingers
There
and
you
all
go.
of those, the palm of the hand.
It is the palm of the hand, absolutely.
Okay.
But those are the things that you can do to really protect your health. And then when you see your doctor and you have your blood tested, we check the kidney function using a blood test called the serum creatinine.
I'm going to stop you on that one, Doc, because you're getting a little far ahead of
right.
us. We're going to take a break. Jake's over here telling me we need to take a break. But we're going to come back and actually roll through each of those conditions you talked about to see the effects on the kidney and also the specifics of what we need to make sure our doctor's doing.
Sounds good, Pam.
All right, stay put.
Good deal.
You stay put. We'll be right back.